If you're over 60, there's one tiny habit that could silently increase your risk of stroke, and it happens while you sleep. No warning, no pain. One moment you feel fine. The next, your arm won't move, your speech is slurred, or you're struggling to stay upright. As a brain doctor, I've seen this happen to far too many older adults. Not because of smoking, not because of bad food or lack of exercise, but because of something most people believe is helping them. Vitamins. Yes, really vitamins. Every single day, millions of seniors pop supplement pills to protect their bones, boost energy, or sharpen memory. And while some do help, others, especially when taken in high doses or at the wrong time, can quietly put your brain in serious danger. Today, I'm going to walk you through 5 common vitamins that may increase your risk of stroke, brain bleeds, or dangerous blood pressure spikes, particularly during the early morning hours when your brain is most vulnerable. Have you ever wondered if your vitamins might actually be harming you? Type 1 in the comments if you're curious to learn more. Type 0 if this is all new to you. And if brain health matters to you or someone you love, don't forget to like this video and subscribe. Let's start with one of the most surprising culprits, vitamin D. Most people think it's essential for your bones, your mood, even your immune system. And that's true in moderation. But here's what most seniors are never told. Too much vitamin D, especially when taken at night, can quietly raise your risk of stroke. I know it sounds shocking, but let me tell you about one of my patients, Mr. Walter, a 74-year-old retired Navy veteran. Sharp, disciplined, serious about his health. Every morning, like clockwork, he lined up his supplements. One of them, a 10,000 IU vitamin D capsule, over the counter. He believed it was protecting his bones. But in reality, that little pill was pushing his body toward a silent disaster. One morning, his wife found him dazed. He couldn't speak clearly. His right arm hung limp. He'd had a stroke overnight. Lab tests later showed high calcium levels, stiff arteries, and blood pressure swings. The cause? Vitamin D toxicity. Here's what most people don't realize. When you take high doses of vitamin D, especially without a doctor's supervision, your calcium levels spike. Your body doesn't know what to do with all that extra calcium, so it starts depositing it into your arteries, making them stiff and narrow. That creates the perfect setup for a blood clot, and that clot can go straight to your brain. And as we age, our arteries naturally lose flexibility. Add in dehydration, poor sleep, and a sudden calcium spike while you're asleep, and you've got the perfect storm for a stroke. The worst part? There are no symptoms, no warning signs. You go to bed feeling normal and wake up with your life changed forever. And here's something else that may shock you. Many over-the-counter vitamin D supplements in the US contain far more than older adults actually need. 5,000 IU, even 10,000 IU. People take these daily, thinking more is better. But studies show even 2,000 IU daily may be too much if you're not truly deficient. Let me say this clearly. If you're taking vitamin D, especially along with calcium or heart medications, it's crucial to get your blood levels checked regularly. And always take it in the morning, never before bed. Do you know how many IUs your supplement has? Type D in the comments if you're currently taking vitamin D. Let's open the conversation. This might just save someone's life. And if this information made you think twice, like this video to help others discover it too. And if you thought vitamin D was surprising, wait until you hear what I have to say about vitamin E. It's often called the heart helper. Many people over 60 take it religiously. But in older adults, it can lead to something even more dangerous than a blood clot, a brain bleed. Many older adults add vitamin E to their routine, hoping it'll support heart health, improve circulation, and maybe even boost memory or make their skin glow. But here's what never makes it onto the supplement label. Too much vitamin E, especially when combined with common heart medications, can increase your risk of bleeding in the brain. Yes, even if you're doing everything else right. Let me tell you a story I'll never forget. Mrs. Evelyn Brooks was 81, a retired librarian from Ohio. Always reading, always sharp. She was witty, well-spoken, and kept a steady routine. Evelyn had a heart valve issue and was on warfarin, a common blood thinner. Her doctors monitored her closely, regular blood work, stable blood pressure, everything was under control. Then one day, she saw an ad in a magazine for a natural vitamin E supplement. It sounded promising, 800 IU per capsule. She thought, why not? It might help my memory and circulation. 3 weeks later, Evelyn was rushed to the ER with a severe headache, confusion, and vomiting. A brain scan showed the devastating truth: a hemorrhagic stroke. Bleeding inside her brain. Not from a fall. Not from uncontrolled blood pressure. But from the combination of high-dose vitamin E and her prescribed blood thinner. Her blood had become so thin that one fragile blood vessel in her brain simply gave way. What most people don't know is that vitamin E acts like a natural blood thinner, an anticoagulant. When taken in high doses, it slows clotting. And if you're already on aspirin, Plavix, or any prescription blood thinner, adding vitamin E can quietly make your blood too thin. That raises your risk of internal bleeding, and the brain is the most dangerous place for that to happen. Just one small bleed can rob you of your speech, your memory, or your ability to walk. And here's the shocking part. While the recommended daily intake for older adults is just 15 milligrams, or about 22 IU, many supplements on store shelves contain 200, 400, even 1,000 IU per capsule. No warnings, no doctor consultation, and many people take them every single day for years, thinking they're doing something good. Evelyn survived, but she now walks with a cane. Her short-term memory was never quite the same. She told me through tears, "I just wanted to help myself. I didn't know I was doing harm." That moment broke my heart. And the truth is, she's not alone. So many seniors believe that if something is labeled a vitamin, it must be safe. But the reality is this: not all vitamins are safe, especially when you're on heart or blood pressure medications. Always talk to your doctor before adding anything new. Now, if the thought of a brain bleed wasn't scary enough, there's another vitamin people take for energy and nerve support that can slowly and permanently damage your nerves. Let's talk about vitamin B6. You've probably seen it marketed as a brain booster or nerve support supplement. Some labels claim it helps with focus, energy, even memory. And maybe someone even told you it's good for aging nerves. But here's the problem. Too much vitamin B6 can actually destroy your nerves. And once the damage begins, it can be hard, sometimes impossible, to reverse. One patient of mine, Mr. Harold Jenkins, age 76, was a retired truck driver from Kansas. He came into my office because his feet were numb. His hands tingled. His balance was off. At first, he chalked it up to age. But then, he started falling. Once, then twice, and the third time, he hit his head on the bathroom floor. When I reviewed his supplements, the problem became clear. He'd been taking a nerve support formula he bought from a pharmacy. It claimed to support brain health and circulation. But each tablet contained 100 milligrams of vitamin B6, and he was taking 2 tablets a day. That's 200 milligrams daily, over 10 times the safe upper limit for seniors. And here's the scary part. Unlike some vitamins that flush out easily through urine, B6 builds up in your system over time. In older adults, this buildup can damage the protective covering around your nerves, like stripping the insulation off a wire. The result? Tingling, numbness, muscle weakness, tremors, confusion, memory issues, and the symptoms creep in slowly. So slowly, many people mistake it for arthritis, aging, or even early dementia. But in reality, it could be vitamin B6 toxicity, a slow, preventable form of nerve damage caused by a pill you thought was helping you. Mr. Jenkins was lucky. We caught it in time. He stopped the supplement, and the damage didn't get worse. But not everyone is that fortunate. Let's be clear, vitamin B6 is important, but only in very small amounts. Older adults typically need just 2 to 10 milligrams per day, including what's already in your food. But many brain support supplements sold online or in stores contain 50, 100, even 200 milligrams, amounts that are not just excessive, but potentially dangerous. So here's what you need to do. If you're taking anything labeled nerve, brain, or energy, check the label, know your numbers, and type B6 in the comments if you or someone you love has ever taken supplements like these. You could help someone avoid a mistake they don't even know they're making. Now, you might be thinking, well, at least vitamin A must be safe, right? It's for eyesight. That's what most people believe. But let me show you why that's not always the case. Let's talk about vitamin A. If you're like many older adults, you've probably heard that vitamin A is essential for vision, immune support, and healthy skin. Maybe you've taken it to age gracefully, or because it was in a multivitamin. But here's what almost no one tells you. Too much vitamin A doesn't just pass through your body, it builds up over time. And when it builds up, it can quietly increase the pressure inside your skull, damage your vision, and mimic the signs of a stroke. Let me tell you about Miss Dorothy Simmons, a 79-year-old retired piano teacher from Oregon. She lived a quiet, happy life. She loved music, taught her students from her living room, and prided herself on being independent. Then one day, the headache started. Then blurred vision, dizziness, slurred speech. Her family feared the worst, a stroke. But her brain scans revealed something unexpected. No clot, no bleeding. Instead, her brain was suffering from elevated intracranial pressure, a dangerous buildup of pressure inside the skull. Her spinal fluid wasn't draining properly. Tiny veins in her brain were under strain. The cause? Vitamin A toxicity. For years, Miss Dorothy had been taking a high-dose supplement marketed for skin and eye health, nearly 10,000 IU per day, every single day, without knowing the risk. Here's what most people don't know. Vitamin A is fat-soluble. That means your body stores it. In your liver, in your tissues, even in your brain. It doesn't flush out easily like vitamin C or the B vitamins. And as we get older, our liver slows down, meaning that toxic buildup can happen even faster. In excess, vitamin A can cause a condition called pseudotumor cerebri, a condition that mimics a brain tumor. The symptoms include headaches, blurred or double vision, nausea, dizziness, even memory loss. And in some cases, the damage to vision and cognition can be permanent. What's even trickier? Many standard multivitamins already contain the full recommended daily dose of vitamin A. But people like Miss Dorothy unknowingly double or triple that by taking additional eye, skin, or anti-aging formulas. The safe upper limit for seniors is roughly 2,500 to 3,000 IU per day, and that's only if truly needed and only under medical guidance. But go online or into any supplement store, and you'll find products with 5,000 to 10,000 IU or more per capsule, taken daily for months or years. It's easy to see how the damage builds up quietly. Miss Dorothy is slowly recovering, but she now needs frequent eye exams, pressure monitoring, and balance therapy. She told me, "I thought I was doing something good for my body. I never imagined it could hurt my brain." And that's exactly why I'm sharing her story, not to scare you, but to give you the truth that too many people don't hear in time. Because this isn't about fear. It's about empowerment. And now, if you thought eye vitamins could be risky, just wait until you hear what happens when a vitamin designed for heart health suddenly causes your blood pressure to spike. Let's talk about niacin, also known as vitamin B3. Niacin is often praised as a natural way to lower cholesterol. Some doctors even prescribe it. You'll also find it in heart health supplements, energy drinks, and fortified cereals. But here's the missing piece, especially for older adults. Niacin in high doses can cause sudden, dangerous swings in blood pressure and even trigger a stroke. Let me introduce you to Mr. Frank Miller, age 82, a retired postman from Florida. He came to see me with a strange mix of symptoms: hot flushing in his face, a pounding sensation in his chest, and moments of dizziness that would come and go like waves. His blood pressure readings were all over the place, normal one day, dangerously high the next. Frank's dizziness came and went, especially in the mornings. His wife thought it was anxiety. His son blamed the blood pressure meds. But the real cause? Something no one had even considered. Frank had been taking an over-the-counter, heart-healthy supplement. The front of the bottle proudly claimed, supports cholesterol and circulation. But on the back, 1,000 milligrams of niacin per serving. He was taking it twice a day. That's 2,000 milligrams daily, more than 60 times the amount most older adults actually need. Here's what happens when you take high doses of niacin. It causes your blood vessels to suddenly expand, which is why your face might flush or feel warm. But shortly after, those same vessels snap back and constrict. This rebound effect can spike your blood pressure, stress your heart, and limit blood flow to the brain. Over time, that kind of daily pressure, like tapping a hammer on fragile glass, causes something to crack. Frank experienced what's known as a transient ischemic attack, a TIA, a mini-stroke. His speech slurred for about 2 minutes, then returned. He thought it was just a weird moment. I had to give him the hard truth. The supplement he thought was helping his heart was quietly harming his brain. And he's not the only one. Many older adults take high-dose niacin without realizing it. Some buy flush-free or extended-release versions online, thinking they're safer. But even those can elevate blood pressure, trigger irregular heartbeats, and interfere with blood sugar levels. Here's what you need to know. For seniors, anything over 50 milligrams of niacin per day should only be taken under medical supervision. And if you have high blood pressure, heart rhythm issues, or you're taking medication, please check your labels. Frank is off niacin now. Thankfully, no permanent damage. But he told me something I'll never forget. "Doc, I thought I was doing everything right. I didn't know I was gambling with my brain." And that brings us to the big question. Now that we've walked through 5 common vitamins, each capable of quietly harming your brain, you might be asking, what should I take instead? Or better yet, what should I eat? It's a great question, because here's the truth. Your body wasn't designed to thrive on pills. It was designed to thrive on real food. Whole, natural, nutrient-rich food that your body recognizes, absorbs, and uses in just the right amounts. Let me tell you about Mrs. Margaret Wilson, age 73, a retired school principal from Arizona. When I first met her, she pulled open a kitchen drawer, packed with supplements: vitamin D for bones, E for heart, AB complex for energy, niacin for cholesterol, a multivitamin, and a few others for brain support. "I'm doing everything right, Doc," she told me. But she wasn't feeling right. She was dizzy in the mornings. Her balance was off. Her blood pressure kept climbing. Something wasn't adding up. So we tried something radical. We cleared the clutter. One by one, we removed the pills and replaced them with food. No magic diets. No trendy detoxes. Just real food, at the right times, in the right combinations. Here's what her breakfast looked like. 1 boiled egg, clean, high-quality protein. Half an avocado, loaded with healthy fats. A slice of whole grain toast, for steady energy. A handful of blueberries, rich in brain-protecting antioxidants. A glass of room-temperature water, to hydrate her brain. Sometimes, she'd toss in a few walnuts or almonds. No powders, no pills, just real nourishment. And within weeks, something changed. Her dizziness faded. Her balance improved. Her blood pressure stabilized. She told me, "I haven't felt this mentally clear in years." Here's why it worked. Your brain doesn't need megadoses. It needs hydration, healthy fats, balanced energy, and micronutrients in their natural form. Some of the best brain-protective foods for older adults include leafy greens like spinach and kale, rich in folate and antioxidants. Fatty fish like salmon or sardines, packed with omega-3s to protect brain cells. Berries, full of polyphenol to reduce inflammation. Nuts and seeds, for vitamin E, magnesium, and brain-healthy fats. Whole grains, to keep your blood sugar stable and support circulation. And the beauty of these foods? They don't just support your brain. They protect your heart, bones, mood, and mobility too. You're not just eating. You're healing with every bite. Supplements aren't always bad, but they should be used with wisdom. Know what you're taking. Know why. And always ask, is this truly helping, or could it be silently harming? If this video opened your eyes, don't keep it to yourself. Like, comment, and share to help protect someone else's brain.